Hey everyone, it's Jaclyn here. So last month I started a video blog and I'm hoping to continue the conversation about mental health from an East Asian perspective. If you haven't done so yet, please watch my first video for more context as to where I'm coming from, who these videos are for, why am I doing this, etc. Today happens to be Family Day, February 19th, and it somewhat ties in with what I like to talk about today. Recently, earlier this month, there was the Bell Let's Talk campaign, and this is the mental health awareness campaign that Bell Canada puts on. I'm not sure how many years, but I believe for a few years at least, and I knew about it already, but I wanted to look into a little bit more, and I found on their website that there were different ways, or they listed different ways that you can help. So for example, they talked about how language matters and how you need to be careful with what kind of words you use in conversations. You can also educate yourself, you can be kind, you can listen and ask, or simply talk about it. And I guess I'll just make a quick pop culture reference here, quoting Boromir, but saying one does not simply talk. Or in other words, it's actually a lot harder to talk about in East Asian families, I find, which I believe has a lot to do with who we are as East Asians, but perhaps can be relatable to other non-East Asians as well. Throughout my upbringing, I have never sat down with my parents in the den or anywhere in the kitchen or at the dining table and openly stated, "Hey, I'm feeling sad today." Nor have my parents asked me how I was doing that day or any day. If my mom ever asked me that, I'd look at her incredulously and would think some alien took over our body. It's strange, yes. It's not common, or maybe it is more common than what we think. And there's several reasons for this, and I'd like to talk about one of them. Emotions is, I find, it's not a focus in East Asian households. The priority lies in going to school, getting a job, making money, doing chores, running errands. It's really all about being a functional human being. And I believe this has a lot to do with being an immigrant. We tend to talk about immigration as if it's smooth sailing, but there's a lot more behind it, and it's a misconception that I feel we believe in, that things get easier for immigrants when they come to a new country like Canada. So as an immigrant, you're thinking about surviving in the physical and economic means. That means making and saving money for basic needs, meeting government regulations and dealing with all that paperwork, figuring out where to get services or access them, making friends and connections with people you can trust, and learning English and the mannerisms of the English language so you can converse with others and not come off as an outsider. And when you think about it, it takes a lot of time and energy towards those priorities, that there's little mental space to even think about mental health. You're not going to go, let me mentally check in with myself today. It's more like you're going, I need to make sure I'm presentable at school or work, that my English level is at par, that I look like I'm fitting in, that I know what I'm talking about, that I get the mannerisms of people around me. Mental health is barely in any of this. As a first-generation immigrant, which means I'm not born in Canada, or some consider me as 1.5 generation, so someone who immigrated to Canada at an early age, I've taken note that this was how I was brought up. When you've hardly talked about your own emotions with your own family for the majority of your life, it's not like you can suddenly strike up a conversation about it. Having grown up not talking about or mentioning about emotions in the household also sends a message that there isn't much significance in doing so. So that is one piece to consider when we think about what does mental health look like in East Asian communities and families. I encourage us to be a bit more empathetic when it comes to simply asking people to just talk about it. When it's not considered a priority in one's livelihood, it's practically non-existent in East Asian families. What does this mean for us in terms of how to deal with mental health in East Asian communities? How do we approach this in a way that is mindful of where people are coming from in terms of their level of awareness with mental health? So just a few thoughts to think about. That's enough of me for now, and I look forward to talking more about this next month.